Myocardial infarction and angina are closely related conditions that both affect the heart. However, they differ significantly in severity and presentation. A myocardial infarction, commonly known as a heart attack, occurs when blood flow to a part of the heart is blocked, causing tissue damage or death, and is typified by symptoms such as intense chest pain, shortness of breath, and sweating. Angina, on the other hand, is characterized by temporary chest pain or discomfort during exertion, as the heart muscle receives inadequate oxygen-rich blood, but does not typically cause permanent damage. Treatment for both conditions can include medication, lifestyle changes, and in more severe cases, surgical interventions such as angioplasty or bypass surgery. Risk factors for both myocardial infarction and angina include high blood pressure, high cholesterol, smoking, and diabetes, but prompt treatment can mitigate the risk of severe outcomes like heart failure or cardiac arrest. Here's a more detailed look at myocardial infarction versus angina, delving into their distinct mechanisms, prognosis, and impact on health. Nature of onset: sudden acute versus intermittent transient. Myocardial infarction, commonly known as a heart attack, often presents suddenly and its onset is acute, resulting from prolonged interruption of blood supply causing permanent damage to the heart muscle. Patients typically experience intense chest pain that may radiate to the arm or jaw, along with symptoms like sweating and nausea. In contrast, angina is the manifestation of transient and recurrent chest discomfort, primarily occurring during exertion or stress. Angina attacks are relatively brief and are due to temporary reduction in blood flow to the heart. While angina can signal underlying coronary artery disease, it does not cause irreversible damage like MI unless it progresses to infarction. Recognizing these differences is crucial for timely and proper intervention. Duration of symptoms: prolonged persistent versus temporary brief. Myocardial infarction, MI, and angina are two conditions that both involve the heart and manifest as chest pain, but they differ significantly when it comes to the duration of symptoms. In the case of MI, the pain is prolonged and persistent, often lasting more than a few minutes and potentially persisting despite rest or the use of nitroglycerin. This pain arises from irreversible damage to the heart muscle due to prolonged lack of blood supply. On the other hand, angina is typically characterized by a temporary and brief episode of chest discomfort, often triggered by exertion or stress and relieved by rest or nitroglycerin. The pain from angina is due to a transient deficiency of blood supply to the heart without permanent tissue damage. Distinguishing between these two can be crucial for timely intervention and treatment. Severity of pain: intense debilitating versus mild to moderate. Myocardial infarction, heart attack, typically presents with intense debilitating pain that is often described as a crushing or squeezing pressure in the chest. This pain can radiate to the arm, neck, jaw, or back, and is usually accompanied by a sense of impending doom, shortness of breath, and sweating. The pain from a heart attack is persistent and not relieved by rest or nitroglycerin. Angina, however, is characterized by milder chest pain or discomfort that usually occurs with exertion or emotional stress and is relieved within minutes by rest or nitroglycerin. This pain is due to transient and reversible ischemia, a temporary decrease in blood flow to the heart muscle without the acute and permanent damage seen in myocardial infarction. Understanding this difference is crucial, as both require different levels of immediate care and long-term management, but myocardial infarction demands urgent medical intervention to prevent heart damage and potential fatality. Duration of symptoms: prolonged persistent versus temporary brief. Myocardial infarction and angina are both conditions related to the heart's blood supply, but differ starkly in symptom duration. MI typically involves prolonged, persistent pain that lasts over 20 minutes and often does not resolve with rest or nitroglycerin, a medication commonly used to alleviate angina symptoms. This pain can also be accompanied by a sense of overwhelming dread and other systemic symptoms like nausea or shortness of breath. On the other hand, angina is characterized by temporary, brief chest discomfort, usually triggered by exertion or stress, and relieved within minutes by rest or nitroglycerin. Recognizing the duration of symptoms is vital for timely and appropriate treatment, as myocardial infarction is a medical emergency requiring immediate attention to prevent heart damage. ECG changes, pathologic Q waves present versus no persistent abnormalities. Myocardial infarction and angina both relate to heart conditions where the heart muscle receives insufficient oxygen-rich blood, yet they differ drastically in their clinical presentations and ECG findings. MI typically results in the formation of pathologic Q waves on an ECG. These Q waves indicate that a portion of the heart muscle has undergone necrosis due to prolonged ischemia. Essentially, cells in that region have died. Conversely, angina, which is typically caused by transient reduction of blood flow to the heart muscle, doesn't cause permanent damage and often exhibits no persistent ECG abnormalities. In episodes of unstable angina, however, transient ST segment changes or T-wave inversions may be seen, but they normalize once the episode resolves. The presence or absence of pathologic Q waves is therefore a critical distinction in the differential diagnosis, guiding treatment strategies for these two different cardiovascular events.